Hello and welcome to Reede Scholars Live. I am Mary Fleming. I'm currently the president of Reede Scholars and an OBGYN by training. And today I'm especially excited to have two guests with us, Candace Jackson Shepard and Kelajah Shepard, who are Mississippi natives and are currently in Pearl, Mississippi. But we'll talk a little bit more about their story and how they got back there. They are entrepreneurs, they are birth workers, and they are doulas. So we're going to spend a little bit of time talking about all of those things in the course of this podcast. So how are you all doing?
I'm well.
I'm also well.
Okay, Mississippi's treating you all right today?
Yes, it is. It's a little warm, but we're good.
Listen, right this time of year, we gotta be happy for warm because it could be a lot of other things.
Yes.
So, as I mentioned, y'all are in Mississippi now, but life took you away from Mississippi for a little bit, right, for your military career. So, tell us a little bit about what branches you were in and where did you go and how was that experience?
Okay. So I graduated from Southern University, and upon graduation, I became a naval officer, and I did some training in California, and then I was eventually stationed in Hawaii, and I was on Pearl Harbor. And after my tour in the Navy, I actually moved back to Mississippi, and that's where our story really starts. And I'll let Kelajah tell about it.
So I was in the Army National Guard for 8 years. I started here in Mississippi, but it allowed me to be on active duty orders, taking me to Texas, Washington, Georgia, and then to Hawaii.
That's amazing. And then back to Mississippi.
Yep.
So I will take a moment just to acknowledge you for your service. We are Veteran Day adjacent. It's coming up, and as I mentioned when we were prepping, it's amazing what you all do, the self-sacrifice, so that we can live the life that we do in this country. So I really, really appreciate this.
Thank
you for your support.
And so when you came back to Mississippi, there was an addition to the family of Bruin, right?
Yes, there was. At the time, I was pregnant, and so I think I was about 3 months pregnant at the time that we came back, and that's what sparked Kelajah starting his doula training, and so he wanted to support me during my pregnancy. So I'll let him talk about it.
So it actually kind of branches into one of the services that we provide, which is a miscarriage service. So we was pregnant while in Hawaii, and she ended up having a miscarriage. But during that pregnancy is when I originally had the thought of becoming a doula to help in her pregnancy.
Now, so a lot of people don't know what doulas are. So one, that you knew what a doula was is phenomenal. So let's go, before we even tell how you all got to know what doulas are and being involved and being interested in being a doula, just tell people what doulas are and what type of services they provide.
So I'll say doulas are support people. They support birthing people. You have doulas for all walks of life. You have miscarriage, fertility, birth, postpartum, and end-of-life doulas. And their role is to provide non-clinical support and education to their clients. So for us as miscarriage, birth, and postpartum doulas, we're providing education, support, and empowerment for people that are experiencing miscarriages, birth, and during their postpartum periods.
Thank you. So, and I think it's really important that it's a broad span. So we often think about doulas just in the inpatient, intrapartum, like while in labor support. But the reality is you support during the pregnancy, before we get to the labor process, right? And in the postpartum period. And the other thing I think is good to understand that doulas aren't just specific to pregnancy and postpartum either. As you mentioned, you can have end-of-life doulas and more, right? So I think the continuum is continuing to broaden, and probably even intensifying. I don't have any data for this, but I imagine it's intensifying post-pandemic because so many people were isolated without support people, and we know how important to have that support at any stage of life, but especially in the pregnancy and postpartum period.
Exactly.
So how did you even find out doulas existed? Like, how did you even know to be interested in being one, or even to look for one to support you during the process?
So I'm not sure exactly how it came across, but I found something. I started researching back in Hawaii, and I saw that they had like classes there. This was pre-pandemic, and then when we had the miscarriage, it kind of sat to the back burner. But then doing the researches of the different organizations, and I chose upon going to DONA, which
Right.
is a very internationally recognized organization for doulas and the training of doulas. And then since it was still during the pandemic, they was offering virtual classes. So that's how I signed up to be able to participate and become a doula.
And tell us what the training process is. How long does it take? So now there's the virtual and in-person options, I guess, but what's the general training process?
So the virtual is 4 days. It was like from 6 to 9 or something of that nature. And then we actually just did an in-person one a few months ago, and that was a 2 day, 8 hour days of work.
Okay. This is very accessible for people. This is not an onerous, like, years-long training. It's something that you can really do on your own pace,
Yeah.
but also it doesn't take a whole lot of time. So that's good to know. The other thing that we know in talking broadly around maternal health statistics in this country, right? But they're deplorable. They're horrible. Mississippi is especially bad. So tell us how that part of the story was inspiring or drove you to actually want to be, also in addition to your own story, wanted to make you want to be a doula.
So I would start with answering that question with so my training actually, because I didn't take the training that he took in 2020. So the training that I took, I actually just became a doula 2 months ago. So end of
Oh, you
September.
were second in this. So the
Yes.
get more and more interesting. Okay, keep going.
Yes. So my official training was the end of September, and how it came about was it was in the Mississippi Delta, and so Donna was hosting a birth doula training in the Mississippi Delta in Indianola, Mississippi. And it was for the Delta Health Alliance workers, but it was also open to the public. And they were trying to get more people involved in birth work to help with the disparities that we are facing in Mississippi when it comes to the maternal and infant mortality rates. And so the training was completely free, and they actually trained us as community birth workers if you wanted to be trained as that. So it was actually a wonderful option. And if anybody else sees this that's in Mississippi, I definitely recommend going through Delta Health Alliance and getting their DONA approved training.
That is wonderful. I mean, thinking about the training being offered in general is wonderful, and that it was free is just phenomenal. And so when we talk about, and we've talked on this podcast a few times about the maternal health equity challenges, we'll say, mostly because I'm an OBGYN and that's very near and dear to my heart, but also it's a national problem, right? It's a Mississippi problem, but it's a national problem. Our statistics are much higher when we think about maternal morbidity, mortality, and even extended to infant mortality, right, than most other high-income countries. And if we think specifically about maternal mortality, so women dying in pregnancy from the postpartum period, 2 to 3 times for Black women as white women, right? And we also know for Mississippi that the statistics are even higher than that. They're worse than the national average. But also the number of providers is steadily declining. And so in addition to having baseline worsened statistics around healthcare outcomes and maternal mortality, you're having less and less providers that are able to intervene for these things. So it increases the need for doulas and other support services during that period, right? Because at least you have somebody who's trained, who's capable, who can help navigate you through the pregnancy and postpartum period and help you advocate for yourself. So a lot of what doulas do also is about patient advocacy and empowerment, right? So tell us a little bit about that part of the journey for you.
So, which is funny that you bring up that the amount of providers are lessened during while we were doing that training in Indianola. We was Delta Health Alliance was speaking on that their hospitals around the area was closing, so people had to either come to Jackson, which is over an hour and a half away, or go another hour and a half to 2 hours towards Memphis to have their babies, or wait until the doctor comes to that area, which is maybe once a week.
Right. And then in addition to all of that, also they're trying to increase the amount of birth workers there to kind of bridge that gap between the providers not necessarily being as available as they have been in the past. And so also there was an issue too with resources of trying to get the women and their families to the hospitals, having rides to get there, having the funds to get there and all of that. And then also the closest neonatal unit is in Jackson. So that's over an hour and a half away. So if women have babies that are in the intensive care unit for the infants, then they have to get back and forth for that amount of time for an hour and a half. And so that was definitely something that we were not necessarily aware of since we're right here in Jackson area. So that brought a lot of light to it, and a lot of light also to how the disparities are happening. Because in my understanding beforehand, I was like, well, where is this coming from? We have all of these hospitals. We have 6 or 7 hospitals in this area, but it's like there are so many other women that do not have access that we have.
Transportation issues are huge, and a lot of times when I'm explaining like health equity issues, and you think about transportation as a social determinant of health and what it looks like in different places. And so in rural America, which could, I work in Maine, it could be Mississippi, but one of the challenges is the space between providers are so far. And to your point, like you got to go an hour and a half this way and an hour and a half this way, and then think if you have a preterm baby, which is what we're at risk for, especially as Black and brown women in this country. And then your baby is an hour and a half up here and you live down here. And that just compounds the issue. And so even when you think, you still see it in cities as well. And somebody brought this up in a class I was facilitating earlier. I'm thinking about a city, it could be any, I mean, it could be Philadelphia, it could be Boston, it could be Chicago, but even people who live on the outskirts of some of these big cities and they need higher level of care from the medical facilities in the city and they're taking public transportation, that's still hour and a half, 2 hour commute, right? Because an Uber ride for that long is not affordable. And then for emergencies, then we're accessing ambulance or emergency care, which is expensive. It's not a good use of healthcare dollars, and it often comes with a high deductible or copay or whatever that's coming out of somebody's pocket that might not be able to afford it. So these issues they're not the same, but they're similar and compounded by wherever you are. So the other thing, of course, we have to talk about is you're a man and you're a doula. And so we don't see that very often, especially not in the maternal health space. And so what gave you the gumption to say, I know this is not a lane that's necessarily modeled for me. You're only the second one I've ever met. And, like I said, I deliver babies all the time. So tell me what inspired you to say, I'm going to walk this lane that I don't necessarily have a role model for?
I guess because of the absence and going through the training and realizing that it's a lot of uneducation in the community. And for fathers and father figures, we don't necessarily have that information to help support and help ease any burdens that may arise during pregnancy, after pregnancy, and then childhood development. So allowing myself to be a resource and a tool to assist people is what I came to.
Love it. And so let's double down on it a little bit more. So, when we look at old movies from yesteryear, right, they usually sent dad outside the bulwark or get some, whatever they used to send them out to do.
A cigarette in their hand.
Right? Not helpful at all. Yeah. But, we definitely have seen more involvement through the process. Like I see more dads and support persons at prenatal visits, right? I see, they stay in the labor room. They don't go sit in the waiting room like they used to do, right? When I was born, my dad was outside and, somebody had to call and tell him. So there's definitely an improvement, like we're going in the right direction. But there's not also, I would say they're present, but not necessarily involved, right? So tell us why it's important to be not just present, not to just show up physically, but to actually be actively engaged and involved in the process.
I guess it allows a level of intimacy because you're able to grow closer with your partner in the process of bringing your children into the world. And then also you having that education, so if something does go awry, you know when to speak up on certain issues or get the necessary help that's needed.
And it was beneficial for me also going through my first pregnancy and having him as my doula there, because the stuff that I didn't necessarily have education on, he was there to be a backup. And then also in the hospital setting, if he saw something that he thought was wrong, he could speak up about it because I wasn't necessarily educated on that. And so it was just good to have him for that. And then also knowing the postpartum phase, the baby blues, and all of that, he was able to help me deal through all of that. And so it's good to have somebody who understands the birthing process, understands the postpartum process, and is able to support you through that versus just somebody who doesn't necessarily understand the hormones and how all of that works, and they're not necessarily educated, so they don't know how best to support you. But he had all of that education, so he was a perfect support for me.
You are definitely lucky. And I think that's important because the other part of pregnancy, it's not a singular event, right? It's a process.
Right.
And things that happen in the first trimester, the second trimester, the third trimester, during delivery, postpartum, they all come with changes, with um, like physical and emotional changes, but then also there's a whole new person, right? After the delivery process that you have to figure out and go home and try to figure out how to incorporate it with the family. So I think it is definitely useful to have as much information as you have going into it. Because I think the other thing that I see, even now with especially young pregnant moms and birthing persons, is that they really don't have any clue of what's going on. So they don't know the questions to ask. They don't have the right expectation setting. So, and it can go either way. Either you let things happen to you that you shouldn't, or you're oppositional to things that are normal because you don't know what the expectation should be. So I think having somebody there to guide you through that process and like, nope, this is what everybody does. This is very normal. This is not, specific to you, or absolutely not. I mean, we need to call somebody right now and having that gauge. The other thing would be interesting to think about is, so the doulas are not new to the birth worker space, right? They're definitely not new. We are seeing them more present in the hospital setting, though. I think over the years it's increasing. And so that is definitely a different dynamic than some of the other hospital workers and nurses, physicians, midwives may be used to. Tell us about your interaction with other birth workers in the space. Like, how has that been for you?
So our interaction has been limited, but I would say we have made some connections that have been valuable. So in the process of me looking for a midwife for my birth, because I'm currently pregnant, I actually became friends with my midwife, and her and I are now starting to work together in Kelajah also. And so she has been brought on to our team for Be Well, and she is a traditional holistic midwife and a doula, and she also is an herbalist as well. And so it's been good to have the resource of her there. Not only is she supporting me, but she's helping to support also other women, and she's bringing me in because now I've become her birth attendant. Because my ultimate goal is to become a midwife also, and so the training that I'm getting with her, the life lessons, and all of that stuff has been very beneficial for us as just parents, and also it's been beneficial for us to grow our business. And so I would say she really has been, for me, the only birth worker outside of the two of us that I've really had experience with.
For me, both of the doula trainer, the donor doula trainers, are great resources. Anytime I need a question answered, they have the platform to answer it. Also, they also reach out to provide extra training and any insight into the business to help you grow and facilitate other networking events. So those individuals have been beneficial to us.
Okay. I'm going to say one more thing and then we're going to switch gears a little bit because you just mentioned Be Well. But for people listening, so we've defined doula. So this the support in this conversation, we're specifically talking about support in the prenatal, delivery, postpartum period when we think about maternal health doulas, right? You mentioned midwives. So midwives also support the pregnancy, labor, and postpartum period, but they are clinical, right? So they can do deliveries. So just
Right.
an important distinction, I could call it. And then when you think about me as an obstetrician, I also do the same thing, but in addition to doing deliveries, usually manage more high risk deliveries. Midwives usually are focused on low risk deliveries. So you think about obstetrician is going to do more high risk deliveries, and then of course C sections if needed. So that's kind of the spectrum for people who are listening to know what we all do. And the reality is, it should be a collaboration between all. So you really need everybody on your team, right? So you need your support, you need somebody to deliver you, and then you need somebody on the ready in case you have a high risk indication that you need to intervene. So that's kind of how the continuum works. But shifting gears, so you talked about Be Well. So you all are well, also entrepreneurs, right? You're doing a whole lot of stuff. So tell us about, first, just tell us what your other businesses are, and then we can dive into how they intertwine.
Perfect. So I own, it's called Sugar and Spice. It's a bakery that I started in 2020. It is a thriving business, and I've always had a passion for baking. Cooking and baking is my first love. And so it was nice to be able to have a creative outlet to turn that creativity into a business and a passion of mine. And now I'm able to incorporate that into our current business, Be Well.
And I started a cleaning company. After I got out of the military, I started King of Clean. It was started off as an automotive detailing service, but it progressed into not just automotive and cars, but doing carpets, upholstery, pressure washing, things of that nature.
And so y'all mentioned y'all have packages that allow people to benefit from all of the things that you do. So tell us about some of these birth packages and how did you come up with this concept and decide that this is how you were going to service your members and your clients?
So we took our other businesses and incorporated it. We felt that they had a purpose within our business because, especially going into your labor and delivery phase, you want to make sure your home is clean. So Kelajah caters to that. And then also women need baby shower, gender reveal, birth announcement cakes. And so I was able to kind of cater to that aspect of the birthing process as well. And I don't know, do you want to hear more about what we have to offer within our packages?
Please.
Sure. So, one thing that I just looking at other doulas in the area, I realized that they only offer 1 to 2 prenatal visits before they actually went into the labor and delivery with their client. And so Kelajah and I wanted to be able to establish a relationship and a bond to be able to know when something was going awry with our clients. And so we meet with our clients currently once a month. And then we do weekly check-ins with them, and that could be via phone, text message, or Zoom. And then we're also on call for them if they have many questions. They can reach out to us, and we'll get back to them. And then we also offer different classes. So we have a labor and delivery comfort measures class, and then we have a newborn care class. We offer birth planning sessions, postpartum planning sessions. He has his father figure support group that he works with the fathers and the support people that are supporting the birthing person. And that's mainly his I would say his lane, where he is there to support and be the doula for the support person. And so when we get to the birth, we kind of can sit back. If we need to step in, we can step in. But all of the education and everything happens on the back end. And so the birthing person is educated. They know what to look for. They know their rights. And also their support person also has the same knowledge and resources as well. And then what else do we offer? There's so much we offer.
Then
Hey.
also with the herbs.
Oh yeah. So with Be Well, so Be Well actually started as a herbal business, and so I was catering to women with reproductive health issues first. And so after becoming doulas, I incorporated herbalism into the birth and postpartum phases. So we offer herbs and consultations to our clients. So if they're experiencing anything, if it's just a cold or anything like that, they have access to me at no additional cost, and then I can make a formula for them. And then we also offer the cleaning services, and I'll let Kelajah talk about that.
So, before or after the labor has concluded, I come in and clean the carpets for the rooms, or you can have your vehicle cleaned and car seat installed in preparation of coming home after you have given birth.
Yes.
Yeah, that car seat install is the bane of a lot of people's existence. So right there, like you've
Yeah.
earned your salt. But I really love this model. One, from a health equity standpoint, when we think about how much of our health is based on things that don't happen in the hospital, right? You all are covering most of that, and like having the support and the pregnancy, labor, postpartum support is amazing. But also having the expectation setting, like I said, is amazing. But also being to troubleshoot the things that can, this is being a little cavalier, but distract us from having a successful pregnancy, right? And and on top of that, thinking about things like environmental factors that can be detrimental to pregnancy and once the baby comes home, right? So having a clean house and a clean car is huge. One, it's less stress.
Yeah.
So we're not being stressed to our person, but it's also the cleanliness and the hygiene of it is beneficial for the person. And I think it's also model setting, right? Like you're also modeling what it looks like to be supported, what it looks like to not be stressed, what it looks like to be able to have a pregnancy process that is not being, well, I mean, it's American, we're humans, but decreasing these external stressful factors that can happen that can impact pregnancy and the postpartum period in a detrimental way. I also love thinking about the herbal component, right? And so a lot of times, especially even when you're thinking about labor and comfort measures, there are lots of ways to manage discomfort and pain and minor infections during pregnancy that don't often have to require pharmaceuticals, right? And so a lot of people are looking for that but don't know how to do it. And so the way I describe it, if you're in a delivery with me, I'm like, we're going to be in the hospital because I work in the hospital, but like whatever you want to do in this room that's, not going to get us in trouble with like, the fire marshal or something, then we can do, because you want to create that inviting space. So I'm like, if it's aromatherapy, if it's your favorite blanket, if your support person is doing massage, if we're doing warm showers, if we're on the birthing ball, there's so many things that we can incorporate to make it as comfortable, if you will, as experience as possible, but getting people prepped for that so that they know what they can bring in, know what to expect. Not that anybody can really know what to expect in having a baby, well, let's be clear, but as much as we can is very useful. So super excited that you all are figuring out how to incorporate as many things as possible. And I imagine y'all have some other stuff on the horizon that will come. I mean, y'all are very creative and inventive. So anything, we didn't talk about this, so not to put you on the spot, but anything you want to share that's coming up on the horizon? Is it a secret? TBD?
I don't know if you want to speak about it. Do you want to speak about it?
Oh, it can be a TBD.
I know it could be. Well, I will say that we are looking to expand our cleaning services to something more. Let's say cleaning services with diapering, cloth diapering.
Okay, I can see that. So y'all even more into the environmental space. I like it. Okay. So my next question is, so thinking about those who are interested in the space or just maybe even want to don't know what the right questions to ask, how would you encourage them or direct them?
That's a great question.
to become a birth worker or to,
Mm-hmm.
I would say, do research, check out like the different organizations such as like DONA, or I know if you're like in Georgia, they have Healthy Mothers, Healthy Babies. So just look around in your community that has the assets to give you the information that you're looking for. But DONA has the donor.org website has a lot of information, gives you the necessary resources to find the path that you want to fit in.
And then the networking too, also with Donna. But I think too, it's also important to reach out to any birth workers in your community and just get a feel for what they're doing, get their experiences, because they do have the inside scoop on what's going on in that area. The what's happening within certain hospitals that you may be particularly servicing. And so I think it's important to reach out to other people, and that's something that I wish I had done before I had started, just to get a feel and kind of start that networking aspect of it also.
Love it. I love it. And then, kind of as we're coming to a close and thinking about, I know one thing y'all are looking forward to is the next new addition to the
Yeah.
family. But anything else you're just, and not, it doesn't have to be specific to maternal health or birth workers. But anything else you're just hopeful about or looking forward to we're about to be in a whole new year soon, but anything you're just optimistic about or hopeful for or looking forward to?
I'm looking forward to where Be Well is going and how we'll be able to help mothers and families within the future. And I see the growth that's on the horizon and is big, and I can see it, especially since we're now getting more people to our team. We have some things in the works where we're offering our very first prenatal pop-up clinic, where we're offering free services to women who may not have access to a provider. So with our midwife, we are doing free pregnancy tests, weight assessments, fetal Doppler checks and monitoring and some other stuff. And so we hope to expand this to other counties within Mississippi to help with the, not being able to have a provider. And we want to be able to do this for free. So also now we're in the works of trying to find funding to keep this going.
Not only that workshop, but the other workshops that we do offer for free,
Yeah.
we are, I guess, excited to expand the amount of people that we can reach.
Yeah, we just had a labor and delivery comfort measure workshop last week, and so that was a really good experience for us. It was our very first workshop as Be Well, and it was nice to be able to network with people in our community and be able to connect with some birthing people and potentially be some support for them during their process and journey.
Well, let me just say, y'all are amazing.
Thank you.
Thank you so much for taking the time with me today. I think for those of you all listening, I'm going to tell you why I think they're amazing if y'all didn't already know. One, they're taking an issue that is, like I said, a national and global issue and taking it on head on, which a lot of people shy away from these complicated um, health and social health equity issues, right? And so I'm just excited that you saw a need and figured out how to address that need. I love that you all are multifaceted and have also entered the entrepreneurial space. For me, part of what I believe is a solution for health equity is improving the wealth gap. And one of the best ways to do that is through the entrepreneurial lane, and you create for yourself, and you don't just create for yourself, like you said, you're also creating for your community locally, and now you're expanding. And so as many people as you can help, both in the healthcare space with direct services, that you also can help build community, create jobs, and put money back in the community, right? And so that those two things together are just phenomenal and can be exponential. I love that. I love your partnership and your energy, that you have found someone that you can also build with, and I think that's exciting and inspiring for people. And I like that you're creating your own path. You didn't decide we're going to go and do what XYZ and ABC person did. You decided you were going to create for your own in your space and are going full steam ahead and are not stopping. You know, you've got so many things on the horizon. So I am super inspired by you all. Again, very humble that you took the time and a chance on us to talk to us today. And I'm looking forward to whatever you do in the future. So please stay in touch. And we look forward to see what's on the horizon for one of your many businesses. And maybe there'll be some new ones come next year.
There will be, but yeah.
There will be. He's like, not maybe. There will be. I love it. I love it. Thank you all so much.
Thank you.
Thank you for listening to Reede Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.